Triggers and cravings are closely related concepts in the context of addiction and habit formation. Triggers refer to specific situations, environments, or emotions that lead to an increased desire for a certain behavior or substance. Cravings, on the other hand, refer to the intense desire or urge to engage in a particular behavior or consume a specific substance. Examples of triggers for substance abuse include being in environments where drugs or alcohol are present, feeling stressed or anxious, or experiencing certain emotions such as depression or anger. For example, a person who is recovering from alcoholism may find that being in a bar or socializing with friends who drink heavily can trigger cravings for alcohol. Similarly, a person who struggles with drug addiction may find that being in certain neighborhoods or around certain people can trigger cravings for drugs. Examples of triggers for non-substance related behaviors include stress, boredom, or certain times of day. For example, a person who struggles with overeating may find that feeling stressed or bored can trigger cravings for food, or a person with a shopping addiction may find that feeling depressed or anxious can trigger cravings to go shopping. To overcome triggers and cravings, it is important to identify and understand them. This can be done through self-reflection, journaling, or working with a therapist or counselor. Once triggers and cravings are identified, it is possible to create a plan to avoid or manage them. One solution for managing triggers is to develop coping mechanisms for the emotions or situations that lead to cravings. For example, a person who struggles with drug addiction may learn deep breathing techniques or meditation to manage stress and anxiety, which can be triggers for drug cravings. Another solution is to avoid or limit exposure to triggers. For example, a person who struggles with alcoholism may choose to avoid bars and social events where alcohol is present. Another solution is to find new and healthy habits to replace the unhealthy ones. For example, a person who struggles with overeating may choose to find a new hobby or activity that they enjoy, such as going for a walk or reading a book, which can help to distract them from cravings for food. Overall, triggers and cravings can be difficult to overcome, but with the help of self-reflection, therapy, and developing new habits, it is possible to manage and overcome them. Addiction is a complex condition that can take many forms. Some of the most common types of addiction include: 1. Substance addiction. This type of addiction involves the use of drugs or alcohol. Examples include addiction to alcohol, opioids, marijuana, cocaine, and other substances. 2. Behavioral addiction. This type of addiction involves engaging in a behavior that is pleasurable or rewarding, but becomes compulsive and difficult to control. Examples include gambling addiction, sex addiction, and internet addiction. 3. Process addiction. This type of addiction involves becoming addicted to a specific process or activity, rather than a substance or behavior. Examples include workaholism, exercise addiction, and shopping addiction. To overcome addiction, a comprehensive approach is often necessary. This may include a combination of the following. 1. Professional treatment. This can include counseling, therapy, and medication-assisted treatment. These options are often tailored to the specific type of addiction, and can be highly effective in helping individuals overcome addiction and maintain long-term recovery. 2. Support groups. Joining a support group, such as Alcoholics Anonymous or Narcotics Anonymous, can provide individuals with a sense of community and support. 3. Self-help strategies. This can include practicing relaxation techniques, such as meditation or yoga, journaling, and setting goals to help individuals focus on their recovery. 4. Behavioral therapies. Cognitive behavioral therapy, CBT, is a common and effective approach to addiction treatment. This therapy helps individuals identify and change negative thoughts, feelings, and behaviors that contribute to their addiction. 5. Lifestyle changes. Making healthy lifestyle changes, such as eating a balanced diet, getting regular exercise, and getting enough sleep, can help individuals overcome addiction and maintain long-term recovery. It's important to note that the process of overcoming addiction is different for everyone, and it's not a one-size-fits-all. It's important to find the right treatment and support that will work for you. It's also important to remember that addiction is a chronic condition, and relapse is a common part of recovery. If someone does relapse, it's important to not view it as a failure, but rather as an opportunity to learn and grow, and to make changes in their treatment plan or approach to recovery. It's important to remember that recovering from addiction is a journey, and it's important to have patience and be kind to yourself. It's also important to have a support system, whether it be friends, family, or professional help, to help you through the process. In conclusion, addiction is a complex condition that can take many forms, and overcoming it requires a comprehensive approach. Professional treatment, support groups, self-help strategies, behavioral therapies, and lifestyle changes are some of the effective tools to overcome addiction. Remember that recovery is a journey, and it's important to be patient and have a support system to help you through the process.